And we are live. Hello, tribers. Can you see me? Can you hear me? Do we have anybody joining us? Let me just check on tribe if we are live. So, till then, let's play some nice music for our tribers.
Yes.
All those who are watching us, please tell us in the comments if you can hear us.
Super Bottoms, happy hai hum. Super Bottoms, to hop, jump and run. Super Bottoms, for baby and mom. Super Bottoms.
Welcome to yet another interesting session just on Super Bottoms. All right. And with that, we are going to start with this session. Hello, tribers. If you can hear us, please let me know in the comments. Okay, I am audible. Can you guys see us properly? Please let us know. All those who have just joined us, please hit the like button and let me know in the comments which city you are joining us from. We would love to know where all our super tribers are watching us from. And to begin with today's session, this session is about postpartum self care and how moms can find time and look after themselves after they have a baby. And for this session, we have with us Dr. Swathi Reddy. Swathi Reddy is a consultant woman health physiotherapist and a certified consultant diet counselor and nutritionist at Motherhood Hospitals. She has done bachelor's in her physiotherapy from Apollo College of Physiotherapy, and she has done her certification in nutrition and childcare. And she has done her internationally accredited diploma certificate in nutrition course and nutrition certificate in advanced diet and meal planning course. As a women health physiotherapist, she has an outstanding knowledge and has done treatment for various medical conditions like back pain, knee pain, and other musculoskeletal problems and post surgery rehabilitation. Her areas of expertise include prenatal and postnatal fitness, treating pregnancy discomforts, Lamaze classes, labor education sessions, postnatal back pains, and guidance in weight loss. Welcome to the session, Doctor. Do you have any
Thank
opening
you.
statements for the day?
Yes. Hello. Hi, Shweta. Thank you for the introduction. And hello, I can see a lot of people joining in and saying hi. Hello to each and every one of you. Yes, it's all about women, how the changes definitely. Once you are a mom, things change. Until you are pregnant, it's different. And the moment you deliver, the next day onwards, the moment you are a mom, the feeling is going to be completely different. There are a lot of things that need to be done ahead. There is a responsibility as a family, like as a husband and wife, as a parents, the responsibility is different. But when we talk about being a mother, the responsibility is going to be completely different, right? So that's what I always feel like, we women should always try to keep up with ourselves also. The reason, because we keep seeing a lot of people complaining about I'm not feeling well, but still they go on with the things. They have to do all the things, so they keep going on, right? But I would tell each and everyone, even your health matters. Only if you are good, people around you are good. Women is the medicine to the society. That's what it says. And then, yes, I always believe in that. If you're good and if you're positive, people around you are always the same. Right. That's what I would like to start the day with.
What a great thought. We are the medicines to this society. Yes, definitely. So, doctor, often when we think about postpartum fitness, the first thought or the first point that comes to our mind is about exercising. So, apart from exercising, what other types of self care women can practice, and what are the other things that they should give a thought to with regards to self care and getting back to health?
Got it. See, the moment pregnancy hits, you are excited. things are going to be different. You're trying to prepare yourself. But when you're into the third trimester, there are a mix of thoughts. You're happy or excited to see your little one, but at the same time, you see yourself in the mirror and you're like, my baby is hardly little weight, like maybe 2.5, but I have gained like almost 15 kilos. What's happening? Where is the other weight going on? You start getting worried, like, will I be able to shed this weight? Because we always tell only one thing: your weight need to be managed, and that's what keeps us on a healthy track. So once you deliver, I would suggest you don't have to start worrying about your health or the way you look or about your fitness right then and there itself. Give time for your body to just get back to its the phase of recovery, whether you had a normal vaginal delivery, whether you had a C-section. Yes, we physiotherapists come to you and we tell you the basic exercises that you need to start. Like, moving your joints, trying to walk a little bit after meal so that your joints are a little bit loose, your circulation is maintained, digestion is maintained, a little bit of exercises which helps in strengthening your back, right? That is something which is very important part, which we can't just forget after having so many back pains, aches, and discomforts, and after having so many sleepless nights during the pregnancy, right? So, because of continuous sitting for longer time, there are a lot of mommies out over there, moms to be, that is pregnant women out there, who are not aware of how things are going to be post delivery. You may have to sit, no, you have to sit. It's not you may have to. You have to sit once in every 2 hours for breastfeeding your little one. You have to sit back for your eating, for just giving time for yourself. So hardly you can see yourself resting out over there. This is how it's going to be. Go with the fact. Shweta was asking, is there anything else that we need to concern about? Yes, very much. Be mentally prepared. Both the partners, I would say not just mom, both the partners, be mentally prepared that you are going to have 3 months of sleepless nights. Don't expect your baby to some kind of a miracle, like, they just come out of your womb. They are awake when they want to drink the milk and they quietly sleep in the night and not disturbing you. That's not how things gonna happen. Even for baby, the womb to world transition is very difficult. We need to understand it's new for them, it's new for you. So mentally, you need to give time for yourself. All the mommies out there, they think that, okay, if my baby is awake, if I sleep when the baby is awake, okay, no, it's selfish. I should not do that. No, who said it's selfish? Only if you recover, only if you feel better, your lactation is going to be good and it's benefiting your little one, isn't it? Right? So that the first 3 months is the recovery time for all the mommies. In the 3 months, we don't advise you to doing any strenuous activities or any strenuous household chores. Only thing that we want you to focus on healing yourself in the first 15 days, especially when it comes to stitches healing. Go with the advice of the doctors, keep the stitches dry. Don't make, if at all you observe any pus or bleed, just go to the doctor immediately. Got it? And little pricky pains will be there at the stitches. That's the process of healing, so nothing to worry. Emotional, see, there are a lot of emotional changes which a mother can see. If any of the fathers are attending over here the session or listening to it, or fathers to be, always remember there is some kind of see, always a hormonal imbalance will be there. Ups and downs will be there in the women, especially during pregnancy and post delivery. Your support is very much required for them post delivery as well. Emotionally, they may not be well built. They are like, taking little time to come out of it. Maybe they had a long labor, right? So they need little time to come out of it. So in the first few days, try to be with them, tell them it's going to be fine. Tell her that, you are there with her, you will take care of the baby. She has to just breastfeed and then lie down or relax whenever it's possible. Give that comfort to her. Don't make her feel that I have to go through everything. Tell her that you are there with her, whoever is with her, whether it's a sister, a cousin, or a partner, anyone. Always that emotional thing will definitely help her. Okay? Because her recovery is very important for your little one to be healthy. That is also one thing which each and every mom misses out post delivery. So, overall, you need to wait for your time to recover 3 months until you get back with your fitness. See, I'm telling fitness exercises are different, and making or starting up with the normal, regular, minimal exercises are different. 6 to 8 weeks post delivery, you can go with the stroller, onto the stroller, take the baby on the pram, and then go out for a walks. You can do that post 6 or 8 weeks. By then, your stitches are healed. Chances of infection is less.
Yeah,
But
I was going
yeah,
to come to that next question. What are some of the safe exercises women can do? Let's divide this into two parts. Safe movements they can do immediately after delivery, be it normal or a C-section. And once they want to start getting back to the fitness journey, what are some of the exercises they can start at that time?
okay. So that's a good question, because this is something a lot of moms to be also keep asking us. As I said, the moment you deliver, it will take at least 12 to 24 hours for you to feel better. In case of C-section, within 12 hours to 24 hours, depending on your condition, blood pressure, doctor will advise you to move around. So once your anesthesia effect lays off, we ask you to do the foot movements, bending and straightening of the knee, and a bit turning to the sides. When I say turning, in case of C-section, it's going to be troublesome at the beginning, because there are stitches right at the point where you need to turn. So always remember, when you are turning, support your stitches, bend your knees, take your foot and hand support to turn to the sides. That's the first thing. And trying to walk after every meal within 24 hours post delivery, once you're done with your meals, breakfast, lunch, and snacks, or dinner, try to get up within the room or outside your when you're in the hospital, outside the room. Just walk around, see the nurses, say hi to them. If some babies are taking baths, just go check out with the bath of the baby bathroom, and then just walk around and then come back. Don't focus too much on your stitches, pain. A little pain will be there. You will be on painkillers. Take that advantage and then move around. In case of normal vaginal delivery, mostly the stitches will be there in the vaginal area to prevent any kind of issues later. So, sitting may be a little bit difficult. Try to sit onto a cushiony surface. That will help you out. Lying down, getting up, keep your legs together. Don't keep your legs wider, cross legs sitting. These should not be done in case of normal vaginal delivery. Got it? Because the stitches will start stretching for that reason. So you can start off with the walking, little joint movements. We call it as pelvic bridging exercise. This is the common exercise to strengthen the back muscles, which you can start within 24 hours post delivery, whether you had C-section, whether you had normal delivery, vaginal delivery, it's the same. You have to just lie on your back, bend your knees, and lift your hip area up. When there's a bedridden patient, when we ask them to, we had to change the diaper, even for the baby, how do you change? We lift their hip, right? It's the same exercise. Bend your knees, lift your hip. That strengthens your pelvic muscles as well as back. And doing a bit of shoulder movements, forward, backward, neck stretches to the side, front, and up. This will prevent any kind of stiffness, which happens because of breastfeeding, because you have to hold and feed the baby for longer time, right? So these are the initial exercises. When coming to the actual exercise, when to start, as I mentioned, wait for at least 8 to 12 weeks. It depends on whether you had normal vaginal delivery or C-section. In case of normal vaginal delivery, you can start within 2 months. Once you're done with 2 months, go get yourself checked with the physiotherapist to know if your belly muscles are completely fine, or if there is any sagginess in your belly muscles, to know if you're having any diastasis recti. When we say diastasis recti, it is nothing but, everyone knows the six-pack muscles, right? Abdominal muscles. They usually get separated during pregnancy, of course, to accommodate the baby, growth of the baby. But within 2 months, they need to get back. In most of the condition, what happens? They just leave a gap. A little gap is there between the two bands, and it doesn't heal faster. In that condition, in case if you're doing crunches or letting your abdominal pressure increase, that things diastasis recti, it's going to get worse, and it can affect your internal organs in the future. Yes, Shweta.
Yeah, so at what point can a lady identify that she has diastasis recti? Can she make it out on her own, or does she have to visit a doctor to get a diagnosis?
Yes. So post delivery, as I mentioned, 6 weeks is your time, 6 to 8 weeks. Once you're done with 6 weeks, if you're fine, you whenever you come for vaccination of the baby or get yourself checked, or if you say now I don't have time, but make sure that within 2 weeks you need to come back. It's a must. After 6 to 8 weeks is what we tell everyone, all the post-delivered moms, to come and get yourself checked. For whatever is the reason you are in hometown and there you don't have any physiotherapist, then what you need to do, if at all, after 3 months, if you feel you are having a continuous back pains, right? Continuous back pain, which is not settling down, you feel your belly is sagging and like a pouch, like, it's like a pouch and sagging. There are little folds in your belly muscles. You can see small folds. That's where it shows there is a gap in your abdominal muscles. You can't start with crunches. You can't start with any exercise which puts abdominal pressure. A lot of people do the same thing, and years pass by when they come to know that there is a lot of other issues because of that. That's when, after 8 years, we had clients who came after 8 years with the same thing. But by then, she had 3 deliveries, and we had to push her for the surgery for that because the gap was too much. She couldn't resolve it after the first delivery. It went on, like, increasing after another 2 deliveries. It gets worse. So after first delivery itself, make sure your body gets back to the pre-pregnancy fitness even before you plan for the next one, which is very important. That's when you're going to be strong even for your second one as well. So 3 months later, after 6 to 8 weeks, get yourself assessed. If you don't have diastasis recti, then your protocol of exercises is going to be different. If you have diastasis recti, the set of exercises that you are going to learn is going to be different. Got it? So there are a lot of do's and don'ts that need to be followed when we talk about diastasis recti. No
Right.
abdominal pressure, no crunches. Like, when you're bending your back, trying to lift something, you need to pull your abs in, bend it, and lift it. You can't just let your abs just leave it like that. And you have to keep supporting your belly muscles all the time, either with the belt or with the proper pajamas, which can, like, give a proper elastic support. So depends on how severity it is, like, how much gap it is. So for that, assessment is something which is very important. You have to make yourself time for your betterment to go and get yourself checked. Okay, anywhere nearby. If you feel that, I can't travel all the way far, it's fine. Whoever is nearby, as long as they are good, they are experts, and they deal with pre and postnatal clients, then only go and get yourself checked.
So
Okay,
talking
and then you can start off with the walks.
just picking up from what you said right now about tying of belts, a lot of times we see people tying belts to their belly in order to reduce the bulginess of the belly post delivery, and we see it in many people where it is not recommended. So as per your opinion, is it necessary for every woman to tie a belt in some case or the other? It could be a belt designed for that purpose, or just a dupatta or a sari that people tie around their bellies. So could you
Yes.
please shed some light on that, the necessity of it, and the what does it actually do to us?
Yes. So the first thing, belt, usually we advise to tie it within 24 hours, like, after the delivery, I mean, to support your stitches. Like, if you wear a belt, let your belly supported along with the stitches, you'll be able to walk, turn, getting up, feeding the baby. It will be comfortable for you. Second thing, always remember, don't go blindly thinking that, okay, I wore a belt for 3 months, but still my belly is same. Does anyone think that the belt doesn't have any mechanism in it which can let your belly bounce back to its shape, right? Belt is for support. That's it. Always remember one thing, belt is for support. If you don't use the belt, what happens? Your belly, like, uterus, imagine you have filled up a balloon with a cotton, and then what happens at one point you remove all the cotton. It got stretched too much, the balloon, and you removed the cotton after cotton or whatever you stuffed, you removed it. Balloon doesn't immediately get back to normal position, right? It takes a lot of time, or it will be in the stretched, a little more stretched position than before. It's the same thing with your belly muscles. Once your baby is out, uterus is empty, but doesn't mean it is going back to its normal position just like that after delivery. It takes 6 weeks. In that 6 weeks, if you're not supporting your belly, uterus, which is empty, it's kind of putting pressure on your abdominal muscles. It's letting your abdominal muscles stretch, right? When you're walking towards the gravity, your belly muscles are sagging, it's stretching. To avoid that, we ask you to support it with the belt. After 6 to 8 weeks, only in case if you're having your belly pooch, saggy, like diastasis recti with a severe back pain, that's when we advise you to go with the belt. If you don't have diastasis recti, you don't have to go with the belt after 6 weeks. Just 6 weeks to support it. After 6 weeks, start working on few of your minimal activities which can prevent the further stretching of your belly muscles. Like core activation is what we call, right? And always remember, you can get yourself checked for diastasis recti anytime. Maybe you're so busy with your newborn, or I won't say just newborn, they become toddlers and you'll get even more busy. You just
We are still
forget
busy.
about
Yeah, we
yourself.
need to
Yeah,
grow up.
right? It doesn't just end. You're just busy. You never got time to think about yourself because, someone was asking. That's what I could relate, and I can tell. You don't think it's been 8 years. It will be too silly to go and get myself checked now. No, it's your body. You will be the one who will be suffering. It's not some others, right? You will be the one who will be having paining, but still you have to carry on things. So of course, it doesn't matter whether you just delivered or 8 years back, 3 years back. Please, if you feel that there is something could be there which might be troubling, just go and get yourself checked for diastasis recti. The word is diastasis recti. You can straightforward go to the physiotherapist and tell them, I want to check my abdominal muscles if I have any diastasis recti. Okay, you can just go ahead and ask them, get yourself checked, and go ahead with whatever the further protocol they ask you to go ahead. Right? So that's very important. Don't ignore your health. That's very much important to go ahead and get itself checked. But always there are do's and don'ts that need to be followed, that you need to keep in your mind. Yes.
So, doctor, one of the most common complaints that mothers have is that the tummy does not go back to the original tone. So, what are some of the exercises? Let's assume everything is in a normal condition, and uh, after the doctor's advice, they can start doing their regular exercises now, and they want to get their tummy back in shape. So,
Correct.
how do you suggest one can get the tummy back in shape?
Okay. So that's a good question, Shweta, because now nowadays we get tempted looking at all kind of diets, all kind of exercises. 3 minutes a day, your arm flap will be gone within a week. 7 days a week, within 7 minutes, it will be gone. You'll lose 7 kgs. Please don't fall for all that. Because if you are looking for your long run or health of a long run, it's always better to take it slow. As I said, it took 9 months for your body to undergo these many changes. Give little time for your body. First importance, make yourself comfortable. Don't think about your body unless and until it's really troubling you, like back pain, knee pains, neck pains. That's the troubling. It's not the weight. Initially, once you deliver, the first thing, the dietitian will tell you what to eat. Make sure that your diet is maintained accordingly and try to move around. That and breastfeeding once in every 2 hours, that will help you to control and lose the weight. First thing, right? So the other thing, first emotionally and mentally get settled. Too many things in a plate will confuse you and it will stress you a lot. So first, let yourself get mentally and physically settled. You just deliver. You need time to, baby is new, things are new. You have too many things to handle, even though it's just the baby, but there are too many things to handle. So just give time for yourself to settle down. It may take for few of them 3 months. It may take 6 months for few of you. It's fine. Give yourself time. Just don't make your body worse by eating the too much fatty foods in your diet. Okay, that's the one thing. Second thing, try to eat on time. Don't skip your meals. You're breastfeeding. That nutrition is very important for the baby. And the third thing, if, as I mentioned before, 3 months later, when you start with your exercising, consistency and the motivation is something which is very important to go ahead. What is your motivation? Okay, you want to lose weight, or you want to reduce fat in the thigh, or you want to be fit, or you want to feel good. What is it? You need to have one target. Based on that, things are going to be different. It's like, I believe in one thing: you look good, you feel good. Okay, look good is not just about the makeup or the external thing. It's about how you look yourself in the mirror. You feel confident, you look confident, that's how you feel. You feel that, okay, I can handle these things. Yes, you can handle. It's all about how you feel. If your focus is on getting better, like, feeling good factor, then you start off joining something which makes you feel fun, good. Like there are classes, online classes, offline classes, where you can do exercises with your little one. Okay, if you feel, no, if my baby's at home, I may not concentrate on my exercise. If that's the way, there are exercises which you can do with your little one. So try to join those classes. Or if you're a person who loves dancing, or like, exercising with Bollywood music, Tollywood music, any music, Hollywood music, I would say anything, basically Hollywood also. I don't want to skip mentioning all those things, but yes, if you are like that, make sure that you play some music. Start with that. 10 minutes of relaxed music. Start with deep breathing, which is very important. And the second thing, start with your exercises with your music which you really love to listen, or a music which you have played so many times to your little one when the baby is in the womb. Hold the baby. First, enjoy it. Don't start with don't jump into exercises. First, enjoy your face. Hold your baby when your baby is awake. Play the music. Keep talking to the babies. Please don't think your baby is just a baby. They know everything. They can register everything you talk, everything you do. So please be careful whatever you do in front of them, okay? Yes, and whatever you talk in front of them. So just hold on to your baby. You start enjoying the music. Just go with the flow. Carry the baby. There are a lot of baby carriers which you get. Just hold on to your baby, onto that. Enjoy your music. Enjoy your motherhood. First, get that bonding, then you feel confident. Okay, I'm doing my exercise, I'm doing my physical activity, I'm feeling very happy, I'm feeling energetic. Then go ahead with the next step. Next day, try to play the music in front of the baby and do yourself a little bit of dance. Third day, you play the same music. Try to do little exercises like shoulder movements, breathing exercises, side trunk stretches, and slow high knees. Everyone knows high knees, standing and taking the knees high, but very slowly and mild. Spot walking, not jogging, spot walking, because you don't have time to step out of the house. Within the house, you want to do, start with the walking. Don't start with squats and all that immediately. Take yourself time. No crunches and all that immediately. Start with the breathing exercises, yoga, thigh stretches, leg stretches, and core activation exercises. That's when you move on to the proper strengthening exercise. Then you move on to toning exercise like planks. Planks you can do only once your muscles are flexible, once your muscles are ready for it. The day itself, tomorrow I'm going to start exercise, I'll start with planks. The body will not take it. You will feel tired. That doesn't make you feel comfortable doing it next day, right? You should feel better. End of the day, you feel tired. When you want to sleep, you're actually sleepy. That's what we want. Take it slow. Choose the right expert under whom you can go ahead and start exercising at least for the first few days. Then step on to your own exercises at home. Don't jump into the gym. Always remember, take your time till 6 to 8 months. See how you can figure out yourself at home exercising, and then gym. Gym is something which I would advise only once you feel you're able to do 40 minutes of aerobics without any kind of discomfort. That's when you can start hitting the gym. Until then, a bit of yoga and strengthening and tonic exercises at home will definitely help you out. Yes?
Great. Okay. So let's quickly take a few of our viewers' questions.
Yeah.
Okay. The next one is I have weak knees due to some old injuries, so I can't squat or do anything that stresses out my knees. That's why everything puts pressure on my lower back while bending or lifting, and it hurts. Any suggestion for that? I am 2.5 years postpartum now.
Okay. So yes, you had, because of your injury, previous injury, you had some knee issues, but I wanted to know if you really worked out on strengthening your knee muscles, checking out on your calcium and water intake. Yes, calcium. When I say calcium, even vitamin D intake is also very important. These are the three things which I want you to start working on. So your focus is on to exercise. These are the three main reasons which you need to start working on, right? And if you are saying that without bending your knees, there are a lot of exercises that can be done. You can do a very mild wall squats, not deep, very mild wall squats. The second thing that you can do is taking a wall support, sitting near the wall support, and trying to take your legs out and in with the legs straight. And there are exercises where you can lie down or sit with your legs straight, put a towel roll under your knee, and try to strengthen your knee muscles. I'm sure if you have consulted someone, definitely they might have helped you out with these exercises. Try to work on that. Don't stop at any point until you feel, yes, now I can even, like, walk around or jump around, move around a little bit without knee complaints. Until then, make sure that you do your strengthening exercises. That's one thing. Focus on knee strengthening. Don't take it as an excuse and leave it and start thinking of what else I can do without bending my knee. Right? Yes, if you are just 2.5 years postpartum now, you are not too old to forget about your knee exercises or knee thing, right? You still have a lot of time. You have to run around 2.5 years. Little one means I can imagine how much you have to run around, right? Then you have to start working on strengthening your knees. So start on these three things. Check out your calcium and vitamin D levels. Water intake is very important, and make sure that you start working out on your further things as well regarding your knee strengthening exercises.
Okay. So, doctor, with all these tips, one question that comes to our mind is, as a new mother, it comes to my mind like how do I find time to accommodate this new regime in my everyday routine? So, could you please share with us like how can we find those gaps in a day and try to use them to get some more fitness out of that?
Okay, that's a good question, because that's one thing we always tell, try to take out your time, but definitely it gets difficult with the little one, especially when you are the only one who has to handle, when you don't have any support at home to take care of the little one. The reason why I'm telling is after 3 months. So anyway, you're going to start putting yourself into workout after 3 or 5 months, not before that. Until then, it's just 15 minutes or 10-15 minutes in the morning or 10-15 minutes in the evening. But when you have to start working on at least half an hour sessions, that's the time when you are done with breastfeeding your baby. Always remember one thing. Once you're done breastfeeding your baby, as I mentioned, whenever you see your baby is lying down, happy, stomach full, and now ready to sleep or ready to enjoy or listen to whatever you're going to play, that's when make the baby lie on the bed, take out your time, spread out the mat, start exercising. We have these so many thoughts. Okay, now baby is done with feed. Let me go and do this particular work which is pending. Forget about the work. I'm telling you that for moms, the morning you get up till the night, there is some other work which is always there, right? There is nothing like, okay, I will have this free time. That's never going to happen. So you have to make time for yourself. Don't make, especially when you are not aware of when the baby is going to sleep, when the baby is going to take feeds, because it still take times. Don't fix a time for exercise. Don't say 11 to 11:30. No, we don't know. Maybe at that time baby wants feed next day, right? Don't fix the time. Give a gap between 10 to 12:30 in the morning. Early mornings I don't advise, because moms need to sleep. Night you may not have good sleep in case if required. So like 10 to 12:30 in the morning, or evening 4 to 6:30 or 7. Between that time, I am going to spend half an hour for myself. As I said, don't start directly with the workouts, leaving the baby over there. It takes time for both of you to get adjusted. First, start off with the minimal movements with the baby, then exercises with the baby. That's when automatically you and your baby will start understanding, okay, mama is playing music, the same music mama is playing, that means mama is going to exercise. The babies will start getting to understand things. That's when you will feel comfortable. Okay, now my baby is calm at this time, now I can go ahead with my workout. If you feel that sound is disturbing the baby, you can always go ahead with Bluetooth headset, do it right in front of your little one and go ahead. Whenever, I'm always telling you, because even I have gone through that phase. Even now I always feel, okay, there's no time, but still I feel I need time. Only if I am healthy, I am going to take care of my people around, my family around, right? Even as I said, I feel believe in that factor. Look
Yeah.
good, feel positive, feel light. These are all related. That's when you can just be on the toes. You are completely free of all the stress. There may be a lot of things, but yes, that should not affect you. For that, the only thing is exercising either to the music, or there are yoga lovers, just go play relaxing music and just indulge into the yoga. Or to start with, start giving yourself 20 to 30 minutes of time for doing something which you loved to do, like hobbies, I would say, reading some books, painting, drawing, coloring, art and craft, or like anything like knitting, whichever like you really loved doing it before, or playing games like chess, or something which is everyone will have something or the other like that. Start working out on that so that you'll understand, okay, I am giving time for myself. That's when slowly push it up. 3 days a week, physical activity, 2 days a week, time for my happiness. That is my hobby. So only when your baby knows that mama is giving time for herself, then only they will understand how important is everyone to take care of their own health. That's what you need to start working on right from the beginning.
Lovely. Thank you. I mean, with that, it's been a great, very insightful session, because a lot of the times we think we don't get time to think about these things, right? And they get shoved under the priority list. But it's so
Yes.
necessary. I mean, after listening to you today, it really felt like we need to modify and, tweak our lifestyles a little bit so that we accommodate that little bit of me time in our everyday routine as well.
Which is very important.
With
Yes.
that, we are at the end of today's questions. Did we miss out on any topics that you wanted to share with
Mm.
us today?
So that's the one thing I think we covered most of it. Diastasis recta is one thing which I want everyone to check on. They should know when to start up. Don't give yourself too much of time, whether it's 6 months or 7 months. But yes, start it up. Give yourself at least 20 to 30 minutes and work on for your own fitness, which is very important. Okay.
Okay.
Yes. That's okay.
Thank you so much for taking out your precious time and joining us in this session today. We look forward to having you with us sometime soon. So
Sure,
thank you once
Shweta.
again.
Sure. Thank you so much, everyone. Have a great day, each and every one.